My name is Don Fleming, Senior Education Coordinator at CASN, and I am pleased to welcome you to this webinar. I would like to start with a land acknowledgement. CASN's national office is located on the traditional territory of the Algonquin people, and we would like to acknowledge and pay respect to the Algonquin people who are the traditional guardians of this land. We acknowledge their long-standing relationship with this territory, which remains unceded. We pay respect to all Indigenous peoples in this region and in all regions across Canada. We acknowledge the traditional knowledge keepers, both young and old, and we honor their courageous leaders, past, present, and future. We'll be recording today's session, and we'll begin with a presentation from our presenters and conclude with 15 to 20 minutes of question and answer. Today, Doctors Jacqueline Limoges and Lindsay Carlson will present Developing a Canadian Education Strategy for Nursing and Genomics. You would have seen their bios when registering for the webinar. Over to you, Jacqueline and Lindsay.
Thank you very much, Don. I'm going to start off, and then Lindsay will join in a moment. I really want to thank CASN for their strong support and advocacy for our work. I met Don a number of years ago now when we were just getting started on some of this initiative. And right away, he could see the importance of CASN being involved in this. And we're very grateful for CASN's support, and it definitely makes this easier. And Lindsay and I are really pleased to be here presenting some of the work of the Canadian Nursing and Genomics Initiative. And I think that some of our colleagues from the CNG are here. I see April Pike and perhaps some of the others. So in a moment, we'll show you who all is part of our initiative. So before I go much further, though, I would like to also do a land acknowledgement. Lindsay is in Toronto, and I'm on the shores of Georgian Bay in Ontario. And we're speaking to you from the traditional land of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and from lands that are now home to many diverse First Nations, Métis, and Inuit people. We honor Indigenous history and culture and are committed to moving forward in the spirit of conciliation and respect with all First Nations, Métis, and Inuit people. Please feel free to use the chat if you would like to make a land acknowledgement. When we talk about genomics, it is particularly important that we do a land acknowledgement and recognize that genetic and genomic discourses are certainly contributing to a lot of good. But historically and even present day, they have troublesome discourses that we need to interrupt and consider. So really important that we always think about the equity issues with this topic. Lindsay and I, when we were thinking about all the different things that we could talk about today, because it's a very large topic and one that we're deeply committed to, but we thought about these three questions, and we thought that perhaps some of what we could discuss would help us to think of possible answers within those questions. So how can leadership accelerate genomics-informed nursing practice and research in Canada? We have seen firsthand the impact of leadership in other countries and how other countries are really doing remarkable things with nursing and genomics. So we know that leadership is impactful, and we've observed some of the contributions that our group has been able to make through leadership. So we're excited to see what else is possible when we increase our numbers of nurses who are interested and engaged in accelerating nursing and genomics. Specifically for this group, and as a faculty member myself, thinking about how can education support Canadian nurses to develop their knowledge of genomics and confidently integrate genomics into practice. You'll hear a very snippet of findings from a survey that we just concluded, a national survey, where nurses tell us that they lack confidence. So what role can we play so that nurses feel comfortable and confident in this area? And lastly, how can nurses with genomic literacy fully participate in precision healthcare, which is fast growing the dominant model of care right now, interprofessional collaborative practice and research, and lead initiatives that promote health and equity outcomes? We know that for nurses to fully engage in interprofessional collaborative practice, they require knowledge and confidence. They go together. So how can we engage in some of this work? So to try and find some answers to these really big questions, we have an agenda with 4 items. So Lindsay is going to talk about genomic literacy and genomic genomics-informed nursing practice. She is a nurse who provides direct patient care and has significant expertise in this area. So we're hoping that by providing an overview of some of the common terms and some of the roles of the nurse, it will help set a vision of what this could look like for us in Canada. Then we're going to talk a little bit about the Canadian and the global context. We're going to do a small compare and contrast to find some of the strengths that we have in Canada and some of the opportunities for further integration in education and healthcare. Then we're going to talk about some of the initiatives that we've started with the Canadian Nursing and Genomics Group. It's the CNG, we call it for short. The things that we have done to try to accelerate genomics-informed nursing in practice and research, and hoping that some of those initiatives can be a springboard for you to do other things and more, or join us, which would be wonderful as well. And then what we want to end with are concrete strategies, hoping that one of the strategies that we propose is something that gets you excited and interested to do more, because there is a lot to be done here in Canada in both undergraduate and graduate education. So over to you, Lindsay.
Thank you, Jacqueline. So, as Jacqueline and I have engaged with different groups and stakeholders, we really understand the importance of going over kind of key terminology and making sure we all have the same understanding to really support effective dialogue and potential collaboration as well. So when we talk about the idea of genomics or the concept of genomics, we're really referring to the study of genes and the complex interactions across different genes, as well as the impact of one's environment and how that impacts the unique genetics that one holds. When we speak about genetics, that's really the study of inheritance patterns and looking at the association between a genetic variation or genetic change that an individual has and a clinical condition. An example that I always think of for my own practice in the space of oncology is Lynch syndrome, or hereditary breast and ovarian cancer, and the well-known BRCA genes. Precision healthcare, which Jacqueline already alluded to, is kind of a new paradigm of care where really our understanding of disease risk is not only informed by different clinical characteristics and family history, but also social determinants of health, and importantly now, genetic and genomic data. And this informs our understanding of not only disease risk, but other health outcomes like treatment response or even adverse events. And then finally, genomic literacy is the ability of a healthcare provider or any individual really to obtain, process, and then integrate genetic and genomic data into their health-related decisions. So as this pertains to nursing, it's really around supporting nurses with foundational knowledge and understanding around genetics and genomics, such that they can then integrate that understanding into their health assessments, health teaching, and even development of care management plans. Jacqueline, do you mind advancing? There we go. So when we refer to genomics-informed nursing practice, this really is that intersection of genetics and genomics with nursing practice. You can imagine that depending on where a nurse's practice, whether that's in public health, health promotion, or oncology or cardiology, that integration and involvement of genomics will look different. But how I often conceptualize this, or is helpful for kind of guiding my thinking, is thinking of genetics and genomics really as a knowledge form that nurses can draw on and then integrate it into different aspects of their care. Similarly to how nurses integrate pathophysiology, ethical knowledge, pharmacology, as they guide or inform rather their health assessment, patient teaching, development of in health interventions. We also, when we think about genomics-informed nursing, it's also about drawing in and pulling from their knowledge of genetics and genomics. And that's why genomic literacy we see as being so important as another knowledge form that can really transform patient care as well as health outcomes, and really enable and support nurses to fully participate in that new paradigm of care, that precision healthcare model. And this really spans different health conditions, some listed here, like cystic fibrosis, Huntington's disease, as well as I already kind of alluded to, in my practice in oncology, more hereditary cancer syndromes like hereditary breast and ovarian cancer, or even Lynch syndrome. Next slide. So as Jacqueline and I were kind of initially having discussions, this really came from conversations that we were having, kind of thoughts we were kind of contemplating around the impacts of genetics and genomics and how that was impacting advancements in this area, was impacting nursing practice. And this was really driven and motivated by questions that were coming forward from the patients that we were interacting with, colleagues that we were interacting with, as well as questions that were coming forward from nurses or nursing students. I know in my practice at Princess Margaret, on a daily basis almost, I'm getting emails or phone calls from patients with questions around the genetic testing, either that they are seeking out independently or questions around the implications of the genetic testing that they've had done already. I can think of a number of questions that even came forward in the last couple of weeks. Patients are really motivated to undergo genetic testing. They're seeking it out through, private companies, if not offered to them in clinical care. And often they need help, and they really come to nurses for credible and reliable information to help answer their questions, as well as help how to navigate next steps. And questions really come from, helping them to differentiate between different types of genetic testing, the implications of their genetic test results, maybe for their own, understanding their own disease risk or the risk for their children. They also come to us often for help to help communicate the implications of their genetic test results to family members, as well as ensure that their family members have accurate information such that they can then, seek out potentially genetic counseling or genetic testing as appropriate. Next slide, Jacqueline. And then from a nursing perspective, I know I get these questions often from my colleagues, and Jacqueline is hearing them from the students that she's working with. Nurses are really seeing more and more across clinical areas the relevance of genetics and genomics for their own practice. And they are really, wanting to learn more in this space, wanting to be able to access credible resources to help facilitate and kind of supplement their practice such that they can meaningfully care for the patients and families they work with. They often have questions around pharmacogenomics and how that potentially impacts safe administration of medication. They have questions around navigating kind of the complex ethical issues that come forward from genetics and genomics, as well as, again, as I mentioned, really are wanting to learn more and have help kind of directing towards credible resources where they can kind of supplement their own understanding and be able to kind of supplement their practice in this area. So as we were kind of bringing all these questions together, and as Jacqueline and I already mentioned, we're having some of these initial conversations around the impacts of genetics and genomics for nursing practice. We really started to kind of cast a vision around what would it look like for nurses and the different roles that nurses hold across patients and communities that they practice, if they really were equipped with that foundational understanding and knowledge around genetics, and really were equipped with genomic literacy. I'm not going to spend time going into all these different roles, but ones that really come forward in my own nursing practice really revolve around the clinical and educator role. And I see it in my own practice where nurses who have genomic literacy are able to, as they're conducting their initial assessments, identify potential patients who are at risk for hereditary cancer syndromes, and then help trigger necessary referrals to specialized genetic counseling or supports, as well as provide meaningful education for patients and families around the role of genetic testing for their family, as well as the implication of their test results for cancer screening or prevention. And then also the collaborator. So nurses, and I feel this, in my own role, having that genomic literacy really allows you to fully collaborate as a member of the care team, developing those new care pathways and treatment plans for patients, especially in oncology, where genomics is really at the forefront of care. Having that genomic literacy really allows you to collaborate across that patient journey and making sure that you're fully kind of immersed in that precision model of care within that team. Next slide. And then finally, as we're seeing these advancements in genomics, and, I think this area is really evolving quite rapidly. We're seeing that every day. We also need to be increasingly mindful of the equity and diversity issues that come forward in this space as well. And I can speak from my own practice, when we look at the literature around hereditary cancer syndromes, who's undergoing genetic testing and who's participating in the research, often it's quite a homogeneous group. They're often self-identified as largely Caucasian, highly educated, and of a higher income bracket. So we know that there's many, underrepresented groups and communities that don't have the same equitable access to genetic testing and genetic counseling. And so by bringing nursing in, equipping the over 440,000 Canadian nurses that we have with genomic literacy, we know that these nurses practice across patients, across communities, and across clinical settings. And that work can really help to advance and increase the equitable access to genetic counseling and genetic testing. And we also know that based on the relationships that nurses have with patients and with these communities, they can meaningfully engage and respond to some of the hurt and some of the damage done historically by genetic testing, concerns around eugenics, and other fears and obvious mistrust that some of these communities have in relation to genetic testing. So I'll pass it over to Jacqueline. I know this is kind of the foundation that really formed our collaboration, really motivated our work in this space. And she's going to kind of speak to the global context around genetics and nursing, and also the liftoff of the CNG.
Thanks, Lindsay. And just to let everyone know that we will be doing a panel at the CASN conference in Newfoundland, where we'll do a really deep dive in the equity issues that Lindsay has just begun to introduce. So let's think a little bit about, some of the catalysts and the different responses. So what's really interesting is that there were similar kinds of things happening in the early 2000s. And it's very interesting to see what happened in Canada. And here I've used the example of the United States. It would be a very interesting example to use the United Kingdom, or Japan, or China, or Australia, or Brazil, many other countries. And for some reason, Canada has had a very different trajectory, especially considering how well educated our nursing workforce is. So around the early 2000s, and this was where I got my interest in genomics. Of course, we all studied DNA and RNA in nursing school, but I didn't really understand much beyond that. But when I was preparing for one of my ethics classes back in the early 2000s, I noticed that an entire issue of the Journal of Nursing Ethics was dedicated to the ethical concerns related to genetics and genomics. And I have to say, I was quite surprised that there was a whole issue of one of my favorite journals on a topic that I'd barely even heard of. So that kind of got me engaged in thinking about this. At the same time, around 2003, the first human genome was sequenced. And you can see here the little diagram that I have, the little graph. That is just in PubMed. I just searched nursing and genomics, and you can see the exponential growth in literature that's been happening. So these are just things happening in the world. And Canada started out quite strong, like most of the other developed countries. And we really need to acknowledge Mary Botteroff's work, because she was a visionary, a Canadian visionary in the early 2000s, recognizing the importance and was really championing this. She did some interesting research with her colleagues. The CNA had a statement about the importance of genetics and genomics, and we were kind of on a path similar to others. And then for some reason around 2005, it just stopped. Whereas in other countries, such as the United States, they're now on their third edition of their scope and standards. So we have no policy in Canada, which you'll hear me talk a little bit more about. We have very little guidance in Canada, yet other countries like the US are on a third edition of something. In the United States, they have, it's not perfect and it's not, universal, but they've got strong presence of genomics in nursing school. They have master's programs that are specializing in genomics. There's quite a significant amount of nursing research in the genomic space, both nurse-led and interprofessional research. So there's a lot of activity. And then here in Canada, something happened. We're not sure what it is in 2017 or so, but there was a resurgence of interest. So we started seeing the nursing informatics group, the perinatal women's and health nursing group start to mention genomics in some of their work. The CNG was formed in 2021. We started to see some nursing research, some interesting work by Dr. April Pike, who's part of the CNG. And on this call, Sarah Duell started doing some survey work, trying to see, where were we at with nurses' genomic literacy. There have been interesting studies around pharmacogenomics, not a lot, but smatterings of it. And the CASN in the 2022 framework for education specifically mentions the importance of focusing on genomics in nursing education. And as I mentioned, we've just finished resurveying Canadian nurses with a very large sample size. So there's a lot of momentum now here in Canada. We have very strong collaborations with international colleagues who have done some of this work. We're learning from the things that they've done. So we're not starting from scratch. We've got some foundation and some good collaboration, but we definitely have room to do more things. So these are some of the impetus, as Lindsay said, that prompted us to form the Canadian Nursing and Genomics Group. And so here you'll see the steering committee. And we're always welcoming new people to join if you have an interest in our doing research in this area. And so really our aims have been the same since we founded. It's to raise awareness, to try to create the infrastructure that will support the integration of genomics, to support research, collaboration, and clinical innovation. So one of the first things we did when we formed was we created an engagement framework. We are not housed within one of the professional organizations. And so we needed to put a structure so that we wouldn't get too fragmented. We're doing this largely off the side of our desk with the supports of our universities and places of work. But this engagement framework has been really important to us because it guides how we interact with each other, how we interact with Canadian nurses, and the ways that we move forward. So our work is largely informed by the knowledge to action cycle and the diffusion of innovation theory. We're slowly moving more toward the CFIR model. And the other part is nursing intra-professional collaboration. We believe strongly that nurses in the different domains of practice and across the different designations will go further faster if we work together collaboratively. So the ways that we go about things, and you'll see it in the next part of the presentation, is that we rely heavily on the literature. There is really helpful literature to guide strategies. People are trying different things, they're writing about it. We can learn from those, the things that seem to work better than others, and move down that path. Every time we start a new initiative, we engage with nurses from the different domains of practice, making sure that we listen to the different perspectives and where things are at. We always look at what's happening in the environment, what's happening in Canada, and certainly what's happening elsewhere to inform our work. And we'll talk a little bit about some of the systematic research that our group has done. The first time we used the engagement framework, we were able to identify 6 of Canadian nurses' top priorities. And if you want to read all the details about that, we published a paper in the Canadian Journal of Nursing Leadership that talks about the framework and the priorities. And I'm going to revisit these priorities in a moment, because that's how we've been structuring how we decide what to do next. And those priorities might be helpful for you as you think about what you might want to do next. So very briefly, there are really useful documents that have been created by the G2NA, the Global Genomics Nurses Association, an extremely collaborative group. And Emma Tonkin and her team created a maturity matrix. It's called an assign tool. And what they did in the development of that tool was they were able to identify 6 critical success factors. So the more mature you are, the more activity you have in those, the more you're well-positioned to integrate genomics into practice. So we use those to guide some of our activities as well. And when we've used the assign tool on a Canadian level, we are very much in the beginning stages. I think we may have made some gains in terms of raising awareness, which is really important, but there still is a lot of work to be done. I teach leadership with Athabasca in their graduate program, and I have students developing leadership competencies specifically for the genomic era. And they use the assign tool to look at their practice setting to identify a focus for their leadership initiative. And it's very helpful because it takes a really large topic into something that's a bit more manageable. So the bottom line, to long story short, is there's very little infrastructure in Canada to support this work, and that will certainly help us. The literature, as you can see from the graph, is significant. And the consensus in the literature is that nurses require genomic literacy for safe, ethical, competent, and compassionate practice. This is a complex science, and there's a lot of myth and misconception. And for nurses to be able to, safely and accurately provide health teaching, support people, they need genomic literacy. And so that's been quite helpful. So what we also know that's interesting in studies that have been done in Canada and I've cited a few here from the United States, often faculty and students have the same scores around their genomic literacy scores. And often enough, faculty have lower scores than their students. So that tells you a little bit about, some of the opportunities that we have. It's very difficult for us to teach things that we don't know about. And what's really significant is that probably none of us in Canada have received education on genomics in our preparation. So it's little wonder that we don't necessarily know much about it, because I think we'd all be in good company to say that, it's a fairly new area for us. So in Canada, here are some of the Canadian studies that pretty consistently show that Canadian nurses have low levels of literacy and low confidence scores, and that they indicate they've had little formal education. And we completed a systematic document analysis in Canada, and there is minimal policy or guideline to guide nursing practice. Those are some of the opportunities that we have to engage in strategies that address some of this. We're in good company. Nurses around the world are struggling with developing genomic literacy for some of the reasons that I just spoke about. But there are global initiatives that we can partner with, that many of us are part of global and international groups. And this is a highly collaborative group of nursing professionals that are very willing to share. And I think the view is that we have so much work to do that we need to share to be able to get it done faster, and there's no point in duplicating efforts. The other thing that the literature tells us, and for any of you who have studied inter and intra-professional collaboration, is that you need to be a knowledgeable practitioner to be able to be seen as somebody that someone would want to collaborate with, but also to have the confidence to lean into it. And so what we know from some of the literature is that interprofessional collaboration and workforce diversity are really important for addressing some of the important equity issues and for being able to really optimize the benefits of genomics. So lastly, is that nurses need support to recognize the clinical utility and to develop the evidence base and the clinical practice changes necessary to integrate genomics. So while we're having some of these challenges in nursing in Canada and struggling a little bit to get this moving, what we do know from our national survey is that nurses are really interested. They see the importance and they want to engage. But while we're figuring this out, it's really interesting to see what's happening on a policy level. So we've just picked out two of the big policy documents that are sort of the national policies. And so in 2022, the government of Canada announced $400 million for a pan-Canadian genomic strategy to ensure genomics findings are diffused to benefit all Canadians, and yet nurses are not mentioned in that document. And we wonder how they're going to do that without nurses. And the same with the CIHR Institute for Genetics. They have a 5-year strategic plan with no mention of nursing. So we feel strongly that we need to develop these competencies so that we can be full participants and really help all Canadians receive the benefit of genomics. So the other upside is that we are making some headway. So CASN, in the National Nursing Education Framework, previously they had used genetics as part of foundational knowledge, and that's been now changed to genomics. And while that might seem like a small change, it's actually a huge change if you think back to the definitions that Lindsay provided, where genomics is a far more complex and expansive knowledge form that requires us to think about, genetics, genomics, the social determinants of health, the environment, interactions between the genes, the impact on treatment response and so on and so on. So it's a significant change that's been made here. And CASN also lists genomics as a topic requiring emphasis. So we need to figure out, collectively, how can we do that? And so we're going to get to some strategies, but I just want to mention that there are resources that have been developed in other countries. And here are just a few examples. So Lindsay's just going to quickly talk about the current state that will hopefully give you a bit of context of how we might move some of the strategies forward. So over to you, Lindsay.
Thanks, Jacqueline. So, as Jacqueline mentioned, there's been some important work done by some of our colleagues here in Canada to give us a snapshot around the confidence of nurses, the perceived knowledge levels of nurses around genetics and genomics. But it was really important for our group to benchmark where we were at a national level in terms of the confidence, attitudes, and knowledge levels of nurses as it pertains to genetics and genomics, as well as to better understand the impact of digital technology, both in terms of study recruitment, as well as sustained engagement through education in the area of nursing and genetics. Next slide. Perfect. So this just gives you a bit of a perspective in terms of the nurses that did complete the survey, over 1,000 participants. So we were really excited with our recruitment, and you can see kind of the geographical span of the participants in terms of who completed the survey over the past number of months. And then the next slide gives you a bit of a snapshot around who these participants were. So on the left, you can see education level. You can see that the majority, around 54% of nurses who completed the survey had an undergraduate degree. And then on the right, we saw a real diversity in terms of practice areas, with over 20%, right around 21% practicing in the community or long-term care, and then representation from many other clinical areas, including pediatrics, ICU, emergency, oncology, and other areas. And then as we get into the next few slides, I think this is really some important insights that come forward. So when we ask nurses around exposure to curriculum or continuing education opportunities that really focused in on genetics and genomics, you can see on the left that almost 68% of participants said that they weren't exposed to nursing curriculum which had a strong component of genetics or genomics. And then on the right, almost 91% of nurses said post-licensure that they hadn't attended any conferences or courses rather that again had that genetics component. So recognizing or identifying rather a real gap in education as well as academically, as well as post in the kind of practice setting as well. And I think this is actually really exciting with these getting the perceptions of nurses in terms of the importance of genetics and genomics, because it really highlights that they're seeing the relevance and seeing the value for their practice area as well as for the practice area of their colleagues. So when asked about, the perceived importance of nurses being educated around, the linkages between genetics and common health concerns, the implications for ethical issues to arise, as well as interactions between environment and genetics, nurses report that they really see the value and the importance of having education in this space, really just kind of signifying that they're engaged and they are seeing the relevance for their own practice as well as that of their colleagues. And then in the final slide, just getting to that idea of confidence, which we've alluded to throughout the presentation, you can see kind of different facets of confidence along the bottom. But kind of some high level takeaways from this busy graph is basically that, nurses report low levels of confidence in terms of understanding the risks and benefits of genetic testing, ensuring, effective and accurate communication of risk, disease risk dependent on one's genetic test result, as well as triggering important referrals secondary to genetic test results. So, collectively, I think if we look at, again, this snapshot of these findings, we know that nurses as we kind of expected, have low levels of exposure to formal training and education in the space of genetics and genomics. As a result, have low levels of confidence integrating genomics into their practice. But I think as a real positive, they're engaged, they're seeing the relevance and value for their own practice. And so I think this really poses an opportunity for nurse leaders, especially in the education space, to really leverage this opportunity and this moment to help kind of build on some of this momentum and help to support and equip nurses given the level of engagement that we're seeing. And I'll pass it back over to Jacqueline to kind of talk about some of the strategies and recommendations around how to build on this momentum.
Thank you. And again, we'll be providing a lot more detail of the national survey at the CASN conference, and just acknowledging that that study was funded by Athabasca University and Memorial University, and really grateful for that support to do that important work. So if you recall earlier, I said that we were able to identify the 6 key priorities that nurses had communicated to us. And these priorities anchor much of what we've been trying to do because there's a focus to it. And perhaps thinking about what you can do at your work setting after lunch, after the lunch and learn, perhaps there's something in these priorities that sparks some interest for you. And so ultimately what the nurses said is that they need assistance to see the clinical relevance. And so to understand, why is genomics important to practice, and what would happen, what could I achieve with genomic literacy? And the start of this presentation gave you some ideas of what, in the different roles of the nurse, what could happen. Nurses really wanted clarity on their unique and overlapping roles in genomics. And certainly we would intersect with genetic counselors, with other members of the healthcare team. So nurses really wanted to know, what do I need to know and what am I supposed to be able to do? And just simply put. And so I think developing that clarity is really important. We need research to develop knowledge for nursing practice. This is a global challenge where we don't have enough research about nursing strategies, our approaches to health teaching that includes genetic risk, for example. So there's a lot of work to be done in that. And certainly we would be very excited to have more graduate students doing research in this area. We need workforce development through education. So not just in the schools of nursing, but for all of the nurses who have graduated. And we know, I've been teaching a long time, if we only do something in the School of Nursing and there's no opportunity to see it practiced, it doesn't ring true the same way. It doesn't have the same impact. So we need to move forward together. And leadership around clinical innovations. What can we do differently? What are the new care pathways, the new approaches? And largely this infrastructure that we keep coming back to, and certainly a CIHR Policy Catalyst grant will definitely help with some of those activities that we need to springboard. So here are 8 strategies that are evident. And so these are things that other people have tried and found to achieve some kind of outcome. So I'm going to just quickly go through these and then conclude with some smaller ideas that come from our own practice. So really the key that comes over and over is that leadership is required, leadership and concerted efforts. Saying that someone has to lead, someone has to come forward and talk about this and figure out a way for this to be integrated into education. Within our individual courses, within our streams of courses, within our schools of nursing. Leadership is definitely needed. And assistance is needed for us as faculty to understand the importance of genomic literacy and genomics-informed practice, for us to understand some of the basic science that goes with this. I think once we understand that, we will become more and more motivated to learn more and more because it's fascinating. And I think that once we understand the importance, we will make room for this topic in our courses, in our curriculum. Most of us will not be able to develop an entire course around this unless you happen to be in a curriculum redesign phase, but thinking about how we can fit this into the courses that we already have. Identifying early adopters, opinion leaders, and champions will be really helpful. It's difficult to do anything alone, and so much easier when we have a little coalition. So finding those early adopters can be really helpful. In our experience, nurses in oncology have been early adopters, followed closely by nurses in pediatrics and the perinatal space, and in cardiology. Those are areas that are having significant impact of genetics, and mental health as well. So those, you might find some early adopters and champions in those spaces. I think we're all time poor. And so addressing the lack of time and the difficulty of finding relevant educational resources have to be addressed. And it does take time to learn anything new, and certainly something as at times complicated as genomics. But as we all know, it's very difficult to teach something that we don't understand ourselves or to even see the possibilities. So one of the ways in that might be helpful is through ethics. We all have a strong ethical foundation to our practice. It's common knowledge amongst all nurses. And so maybe finding ways to engage with genomics in that space could be a useful way in. The other is using the assign tool and the roadmap for strategic activity that have been developed through the G2NA, and the references are at the end. Those can be ways that you can sort of in a systematic way look at your work environment and see where are the opportunities. And lastly is really thinking about ongoing education at all levels, from entry to practice to continuing education. It is required to support the integration of genomics into practice. A number of studies have shown that without that opportunity for clinical integration, students don't seem to retain the information. So we need to move forward together in that way. So here we have this, back to this theme of collaboration across the domains of practice, education, clinical, and policy. I mentioned that our group and Rebecca Puttester is a PhD student, and she led the article that will come out in the Canadian Journal of Nursing Research very soon that reveals the findings of our document analysis that shows just how little there is to support nurses. So we need to have the policy, we need to have the clinical, and we need to have the education. So these are some recommendations that, maybe after the lunch and learn, you might think about some small activity. And if we're all doing things, again, collectively, it becomes quite impactful. So, can you consider strategies that optimize collaboration across the domains of nursing practice? It's not reasonable to think that we're all going to become experts in genomics, but there are people in Canada who have expertise. And how can we collaborate and use the strengths that we have? I think that it's a very possible strategy to add 1 or 2 articles to our course and maybe one learning outcome associated with that, so that we can begin to raise awareness and promote the development of genomic competency. I think adding one learning outcome to one of our classes is really quite doable. I think it could also be interesting to create an optional assignment for students to specifically focus on a topic in genomics, so that those who are interested, those early adopters, those innovators, can begin to explore that and start building strength within our profession. I think that there will be opportunities. You will receive invitations from us to engage in some of the policy development work that needs to happen. So when the invitation comes, say yes, come and join us and have your say. And in the meantime, be thinking about, what do you think would be competencies that are appropriate for nurses? What are appropriate learning outcomes? What should be in practice guidelines, so that we come able to do that work? And if you're equipped to either conduct or participate in research on genomics-informed nursing strategies or developing nurse-sensitive patient outcomes associated with genomics practice, that would be really helpful as well. We've hardly touched on the EDI issues with genomics-informed nursing, but there is really wonderful articles that have been developed. So engaging in activities that can help raise some of the self-awareness, some of the sensitivity to these issues can be a practical strategy. And lastly, focusing education and research efforts on the nurse in direct care, so that we can generate evidence, policy, and education for practice, so that we can quickly get nurses as role models for our students when they move into their clinical placements. So in conclusion, genetic testing does not improve outcomes. Everybody can have a genetic test and it won't change anything. It's the follow-up care. It's what we do with the results. And that's where nurses can have a significant impact in helping people understand the meaning and significance of that test. So we really do need research to guide best practice, and we need policy to influence the implementation of genomics in ways that demonstrate our public accountability and our commitments. And lastly, an important thing is education and workforce development for undergraduate and graduate programs is really important. So the undergraduate will create the strong nursing discipline, and those in graduate programs that are doing graduate programs to become clinical educators or leaders, the more they can know about this, the more they can help to position the workforce in that area. So we invite you to contribute to the work that we're doing, or if you want to continue discussions, I've put my email address, and we'll take some questions now. And I'm going to just switch to the next slide. These are some of the recommended readings that you may wish to consider. There's some of the things that our group has written. And as I mentioned, the article that Rebecca Puttester is the first author on is coming out shortly. The DOI is there, but we don't have the full citation for it, but we didn't want to miss the opportunity to highlight that important article. So questions?
Yes, we have time for some questions. So either if you want to stop sharing, Jacqueline, then we can see everybody. And so that if you want to put your hand up or just speak out or in the chat, however you would like to do it. So anybody have questions or comments?
Hi, if I can join in. My name is Sharon. Hi, Dawn. Haven't seen you in years, but hello there. I started out, at Medicine Hat, so that's why Dawn was one of my mentors. I'm over here in the Middle East, and the Middle East has done a lot of good work on genomics. Since 2009, they started their program here when I was here previously, and they're doing a fantastic job based it on the UK model as well. And from that, I've created some, it's a 2-hour nursing lecture cases, that sort of thing, in one of our alterations in health class, as well as we go through and we look at some of that, the breast genetics that put people at risk for their breast cancers in the cancer course that I teach as well. So I would be happy to share any of those initial things that I teach the nursing students here in the baccalaureate program. If you need them, just let me know.
Thank you, Sharon. Could you pop your email address in the chat? I'm putting mine. Somebody rightfully commented that it came down too soon.
Okay, yeah.
That would be great. Or here's my email. You're welcome to. It would be wonderful to hear from you.
Thanks, Sharon. Nice to see you. Suzanne had her hand up, I think.
I did.
Yeah.
Good morning, everyone. What a fabulous presentation. And so I was in the States in early 2000 up to 2010, and as a maternal child educator, that was a huge focus. We were sending faculty to the NIH to get education about bringing it into nursing curriculum. But what you all presented today with how far it's come, I think we're well positioned in nursing to begin incorporating it. And as my clinical specialty of lactation, we're just beginning to learn all the complexities there with genetics as well. I'm wondering about openness to creating some open education resources at a foundational level. And I'm just building off of my own experience. That's what I've done for lactation and communication now as well. So just curious about opening up ideas and brainstorming.
Thank you. And, great point. And open access is definitely, what we hope to do. We do have a website where we have tried to put some of our presentations that we've done. We're trying to make all of our publications open access. And we do very much like the model of Health Education England and the Oncology Nursing Society in the US, where everything is open access. I think you have to give them your email, but everything's free. And so we really think that that is the way to go in Canada. And, we need to Canadianize the topics. And, but absolutely that would be a good approach. And, we need resources to do some of those things. but we are working our way toward that. So again, any materials that you have that you can share, definitely reach out.
Sarah?
Good afternoon, everyone. Thanks, Jacqueline and Lindsay, for another great presentation. And again, congratulations on the unbelievable amount of progress you've made in a very, very short period of time. I'm also intrigued in, again, if you've had any initial thoughts or based on your network, ways of starting to embed this in the curriculum. So slowly throughout the course of, let's say, 4 years for the undergrad degree, and even looking at for practical nursing programs, as opposed to, yes, there are opportunities for dedicated courses, but how do we start to introduce the concept early, whether it is in those earlier courses that focuses on health and wellness and social determinants of health that you've identified, but how do we, I hate to use the word sprinkle it because it sounds just so non-academic, but how do we introduce it and keep introducing the concept so it does become part of practice, just as we do with other concepts? I'd love to hear your thoughts on that, or anyone else around the table.
Thanks, Sarah. And Sarah is an early adopter and a big supporter of this work. And I really want to give a shout out to Sarah because it took a little bit of a leap of faith, to see where this was going. So there's a lot of different ideas, Sarah, on how to do this. And so some people think that it should be, spread throughout all of the different courses, and some people think the standalone course is the way to go. I think right now in Canada, with where we're at with the faculty comfort with genomics, my wonderment is if a standalone course isn't the way to go, because then only a few faculty need to really develop the background for it. Having said that, in courses like health assessment, the way that we collect a family health history while thinking genomically and while thinking about cultural safety and fictive kin and so on, really, does change the way we go about doing it. But I wonder whether it's a lot to do all at once to think of putting it throughout the curriculum. But I do like the idea that we proposed about one learning outcome, in a class with a couple of articles, that's suitable for that topic as a way to kind of, get an inroad into it.
Erin?
Hi, thank you for the excellent presentation. And I don't know if it's a question or an idea. So you're talking about embedding it in curriculum. And at this very moment, we're actually building a clinical bioinformatics program. And so I'm wondering what kind of content could we build in before we even really, because we're just starting, that could support what you're talking about in terms of providing nurses at various levels of their education with some of this information. Like, what are those key pieces that when I'm talking to the team would be like, oh, we got to make sure we add these pieces in. So I think that would be a great way, at least in the short term, before every nursing program has time to redo curriculum, because we all know that that doesn't move very fast, that maybe we can offer at least some of this great content and fill some of the need.
And Lindsay, maybe you can talk a little bit about some of your ideas that we've talked about the foundational knowledge, just some of that piece might be helpful.
Yeah, I mean, I think it kind of goes back to Sarah's question as well around how do we build this in, recognizing the expertise of faculty and, the competitive nature of building these curriculums in terms of all that needs to be taught in such a short period of time. I mean, I'm of two minds of this. I think sprinkling it in is very important, but I do think there needs to be foundational content that is built in even as a module or something. So I'd be interested to hear a bit more about the bioinformatics and potential ways to collaborate with that. I do think that based upon the practice area that nurses move into, genetics and genomics is going to be quite different. Like how I use it in oncology is very different than how my cardiology colleagues use it, and very different than my prenatal colleagues at Mount Sinai next door use it. So I think building those core concepts and competencies, yes, is very important, such that, the terminology, the understanding of different genomic technologies, all of that content is there. But then the implications, the type of testing that's used in different clinical settings, that's where I think more the nuance comes in. So I think that's where the challenge is in terms of how do you provide kind of that solid base, and then also point nurses in the right direction once they're in practice to kind of supplement that knowledge. So I don't know, Erin, I'd be interested to kind of talk with you offline around potential ideas and stuff, because I need to think it through a little bit more, but I think there's a definite opportunity there that could be quite exciting.
Happy to. I'll put my contact information in the chat.
Yeah, that'd be great.
And I'd like to add
Sorry,
two
Jackie.
things, Dawn, just before we leave that topic. I think it's a lot to ask for all of us to go off into all of our schools of nursing and try to do this work alone. And, is there not a way that we couldn't, come together and figure some of these things out? And part of that policy work that I mentioned that we're really keen to do will help us. And I think that work will start to unfold quite quickly, will help us figure out, what do nurses need to know and be able to do? And it'll start to set some of those learning outcomes and help us to guide some of that thinking. I'd also like to add for the bioinformatics is really also thinking about informatics in this. We didn't have time today to get into that, but that is absolutely an area that we need to be thinking about. How can we use the electronic health record to support our practice and to help us as nurses start to collect data in ways that are very meaningful and can help move this further faster as well. So sorry, Dawn, I just wanted to throw those things in.
Sue?
Hi, Jacqueline. Nice to see you. And Lindsay, thank you very much for your presentation. It was very interesting and very informative. And I'm happy to have met Jacqueline a couple of years ago to learn a little bit about this area, but not an expert by any means. But I am happy to say that, so I'm at Toronto Metropolitan University, formerly Ryerson, and we've undergone a curriculum revision over the last few years, and it's sort of gone in stages, and I teach in the 4th year program. And so for next year in our new professional practice course, we are going to include some content related to genomics. That what it is exactly yet is to be determined, but I'm very interested in collaborating with people around what types of resources people might be using in their courses. If there are some open access resources, I'd love to hear about that, because we do embed some module type activities related to other concepts. So I'd love to touch base with people on those things. And I think I would agree with you that we can certainly embed a few articles and at least a learning outcome related to this area. So thank you very much. And I'm really happy to have attended the session today.
Thanks, Sue.
So it's close to the top of the hour. We like to finish things because people have other things to do. I don't know, Jacqueline or Lindsay, do you want to say a final word or two before we sign off?
No, we just really appreciate the engagement with this topic, and it's really a pleasure to speak with our colleagues in education and to see the interest, and hoping that we can keep the momentum going and do really great things in Canada. We're certainly poised for it.
Very good. Now, I see Letitia, you have a quick comment?
Yes, thank you. Great presentation today, and really interested in working with anyone in integrating genomics into nursing. Canada College has a strong biotechnology program, and we have developed a postgraduate certificate in functional genomics and counseling. And so it's open to physicians, students, and nurses. And it talks about different profiles and what the like how to do the sequencing. We have a DNA lab. We have multiple sequencers, and so mostly it's about teaching how to do sequencing and what it means and how to counsel clients with that result. But and as you say, it is different for all the different if it's urology versus breast cancer versus the difference. But so I'm interested in been looking for the last year or so as we developed our own BSCM program, how we might turn something into an elective of some sort for nurses to take in their 4th year in our program, and how that content might be of value to obviously like how we could not rewrite it, but use it to support some of this discussion we've had today. So certainly I'm very interested in working collaboratively with anyone in the group today as we move forward with developing something. I think like any specialty in nursing, it might be an area that some might delve into, and others, it's just an awareness of it. You know, I'm not sure everybody needs to know how to do it, although I think in the future it will be part of healthcare and, as you know, individualized health. So, but I don't think we're all there yet. But I do think it's important to at least share where we think, you know, healthcare is going in the future, and where our nurses might have a stronger impact or larger scope of practice than they thought they did. Anyway, so I'm willing to work with anybody. That'd be great. Thanks.
Thank you. And just one last recognition of the members of the Canadian Nursing and Genomics. You're seeing Lindsay and I, but we're a team that moves forward. And so thank you.
Well, thank you, Jacqueline, Lindsay, and thank you all who've registered, and all who have registered will automatically receive a recording of this presentation. So again, thank you everyone for joining us, and have a good rest of the day.
Thanks so much.